Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, May 18th, and thank you so much for joining us. As always, this is your opportunity to get your COVID questions answered directly. You can put them into Facebook or Twitter, you can use the box below, or you can use the hashtag AskDrArwady. I myself did join Facebook about, a week ago or so now, and I'm at Dr. Arwady on Twitter, but if you want your question answered, the best place to put it is really when we're live on this show. I have a guest with me today. This is Tamara Mahal, and although you may not have seen her before, she has really been the driving force behind so much of our vaccination efforts here in Chicago. She has been leading on all of the vaccine operations at our Vaccine Operations Center. And so many of you put in questions about where to get a vaccine, how to get a vaccine, the Vax Bus, what are we doing in terms of getting vaccine out, all of our pods, and Tamara and her team really have been the ones leading on that. So I thought it'd be good to bring her in. So before we start, let's just check our social distancing. As a reminder, I still am getting over a cold myself. I've been very careful about my distancing, my hand washing, my masking, because I do not want to spread this with anybody. So can you tell us just a little bit about yourself? How did you end up in this role? And a little bit about what you've been doing so people know the kinds of questions to ask.
All right, great. Well, thank you for having me on, Dr. Arwady. As Dr. Arwady mentioned, I'm Tamara Mahal. I'm running the vaccine operation for the city of Chicago, but you may be surprised to learn that actually my full-time day job is out at the Department of Aviation, where I run everything from emergency management and safety to working with risk management and actually overseeing our 911 communications. And I think one of the questions I get asked most often is, how did you end up in this role? And so to really talk through that, we have to look at emergency management, which is my career. And actually, we were very lucky in the city of Chicago to have an extremely dedicated and talented pool of emergency managers working at places like the Office of Emergency Management and Communications, an extremely talented pool of emergency managers at the Chicago Department of Public Health, but also at the Department of Aviation, where we really oversee airport emergency preparedness and response. I'm fortunate that I've actually spent the past 15 years responding to disasters and helping to really coordinate some pretty complex incidents, everything from hurricanes and tornadoes to ice storms and some man-made hazards as well. So when we knew that the vaccine operation was coming up, we knew it was probably going to be one of the most complex operations the city of Chicago had really implemented. When we knew that our pool of emergency managers had been dedicated to COVID response, they needed a little bit of support to come in and help run things, I got tapped and asked to come over and dedicate some time. Since December, I've been very privileged and proud to work with a large team of city representatives from across all of the different departments.
All the departments.
Literally all of the departments. To actually set up a vaccine operations center, which is where we actually have coordinated all vaccine operations since December. And to be able to do everything from help allocate vaccine to work with our extremely talented pool of medical directors to establish medical policies across our vaccination sites, to set up the city's vaccination sites, and really now in this phase transition over to more of what we're calling hyper-local mobile approach, coming up with and helping to implement some of the various operational strategies that we are deploying now to make sure that we can get to people where they're at and make sure we can provide as much access to vaccine as possible. So it's been a privilege, and thank you for having me on.
All right, perfect. So you can go ahead and put in questions for Tamara or for me. I do just want to note, seeing what some folks are putting in already, we are doing a press conference at 1 o'clock today, and we'll be giving updates related to the CDC mask guidance, how that fits in with the state really at that time. So we're not going to get into a whole lot of that this morning on Facebook, but really anything else, go ahead and put in. I have an exciting announcement, which is that we have an update to our dashboard. And I know that people who follow along on this show look a lot at data. And so the landing page has not changed. It's still chai.gov/COVID-. But if you pull it up, and let's pull it up, you can see that it has changed quite a bit. And that's because we've pulled a lot of vaccine data, case data, hospitalizations data. We're able to do it really, again, in this more hyper-local kind of way. And so first, if we just take a quick look to orient ourselves, you can see our cases. We're currently averaging 311 cases per day. That's coming down really nicely. Remember, we want this number under 200 per day, and then really to be controlled much even lower than that. But this is good progress. It's down 28% from just a week ago and heading the right way. And then similarly, you can see our positivity down in the right corner here now is at 3.4%, down from 4% a week ago, also looking good. But you can also get a sense of what else is happening. Our vaccinations, we're doing almost 12,000 a day, but you can see that that has dropped also since really our peak in April, and we can talk a little bit about that. Our hospitalization numbers are coming down nicely. We've still got about 16 Chicago residents getting admitted every single day to the hospital with COVID. And we have about 7 Chicago residents dying every day still of COVID. And some of that is a little bit delayed from the surge, the little surge that we had over March and April, but that's where we are now. So I'm not going to go through this whole thing, but I just want to give you a sense of how much is in here now and encourage you to explore. You can put in questions today. We'll also look at some more things on Thursday, but you can look at everything you want to look at related to cases and hospitalizations and deaths. You can look at it by age, gender, race, ethnicity. You can look at everything related to cases, both most recently and cumulatively, by zip code here, or tests, or deaths, or positivity. You can compare a zip to citywide. Anytime you hover over a zip code, you'll get really up-to-date information about the population, the positivity, cases, tests, deaths, graphs. We've got a new tab here related to testing. So similarly, you can break this down any way you want to. But then also I want to highlight, we've pulled vaccination data in here. And I know a lot of you have been looking at this every day as I have, but this was a way to really combine up a little bit more how we're doing. So you can see, for example, right when we click on vaccination, what our coverage rate, which means what % of the population is vaccinated. So as of now, 59.5, basically 60% of those over 18 have gotten a first dose of vaccine, and about 69% of those over 65 have gotten a first dose of vaccine. And then if we look at our completed vax series, so while about 60% of those over 18 have gotten a first dose, only 47% have completed it, meaning they've gotten both doses of vaccine, or one if it's a J&J. And then you can look at this by age, really with a lot more breakdown. You can look at it by gender. You see we've got many more women than men getting vaccinated. You can look at it by race, ethnicity. You can also look over time. If you want to get a sense of that, you can see what daily average doses are by different demographics. You can look at different age groups. And then finally, our vaccines by zip. And I really encourage people to explore this. And we're going to talk in a minute about some of the ways in which we're continuing to really focus vaccination efforts. We know there are a lot of people who may not have been vaccinated yet, not because they've said, I don't want to be vaccinated, but just because it hasn't been as convenient or as easily accessible as it could be. And so that's a lot of what our strategy is now. But I want to just highlight for you, because this is really brand new for us. You can look and see, if zip codes that are in dark green here mean that they are over that 70%, which is our goal of vaccination dose. The light green, meaning they're over the city average, the yellow under, and then the red is really, really significantly below. And you can look on this graph here, and you can see, for example, if I slide it, these are the zip codes that more than 70% of the population has at least one dose. You can see it's a very, very small number. It's really just those zip codes right near the loop that have very tiny populations. Some of these have fewer than 1,000 people that live in them. But then as we back it up, we look at which zip codes are 60% vaccinated. Again, just with one dose. And you see even that is still relatively small. We go to 50% and we're getting more of the city. But as you keep backing up here, you see these patterns, right? And so like here where we're looking at the 40% coverage, you can see there's about 13 zip codes here that are on the west side and then really across the south side where a lot of our focus is going. And we're going to talk about that in just a minute. But then if we back it up even more, we go to 30%. You can see it's really, there's one zip code here, which is Englewood. That still is where we're putting the most efforts. You'll see a couple of these zip codes kind of on the edges will sometimes light up. That's usually zip codes that are shared with Cook County. We could talk about those at another time. But I really encourage people, you can look at completed vaccination, total doses. We've got a lot of information on here, and I encourage you to explore this. We are using this kind of information every day and really wanted to make it public. So the last thing I'll show before we get into your questions is just a couple of slides quickly. So first, let me get into slideshow. We did update our travel order today, and you'll see that there's only 7 states at this point that are still on the travel order, meaning states that are having more than 15 cases per 100,000 per day. That does include Michigan and Minnesota, relatively near us here. But the country overall is making really good progress, and that was a lot of the decision, really recognizing how important these vaccinations have been in terms of getting COVID under control for the CDC's recommendation. Just as a reminder, anyone who is fully vaccinated is exempt from this travel order. Otherwise, you still need to either get a negative test or quarantine when you return to Chicago from any of those orange states. On our risk matrix here, you see that 311 cases, we're still at moderate risk in terms of our cases there. Our test positivity is at lower risk, which is good, and our hospital and ICU still are in moderate risk. Our vaccine coverage, really by city, something's a little strange with the way this is showing up, but we continue to really lead across all of the large U.S. cities for both Latinx and Black coverage, but there's still a very long way to go. And then just at the United Center, we have administered more than 270,000 vaccines and more than 55,000 translation services. We've done more than 1,000 vaccination events across the city. And then our Protect Chicago Homebound, we've visited more than 1,700 homes at this point, administered more than 2,500 vaccinations. This is just showing some of the places our vaccination bus, our vaccination station is going to be. Tomorrow we'll be in South Shore at the Atlas Senior Center. Thursday we'll be in Englewood at the Red Shield Salvation Army, and Roseland at Chicago Cred. Friday will be at the North Austin Library. And just a reminder, as always, anybody over the age of 12, you are eligible for a vaccine in Chicago. ZocDoc.com/vaccine is your best place to go to get an appointment. But 312-746-4835 is where you can call, should call, 7 days a week. We've got people there. There are folks on the phone who will help solve whatever problem needs to be solved related to getting you or somebody you love a vaccine. So with that, let's turn back to Tamara and to your questions. So can we start out a little bit? Because we've gotten a lot of interest in the Homebound over time, and we've been to a lot of places. So can you give us an update on sort of what's happening with that and where we're going with it?
We're so proud of that program. We're still one of the only major cities that's actually undertaken the effort to really go and address providing vaccines to our most vulnerable population. And so when you hear those stats, 1,700 homes visited, that is no small number when you consider that we're going to someone's home, spending significant amounts of time with them to get them, and not just them, but their caregivers, their family members vaccinated, and we're really proud of that. But we've also started to see a slow in demand there, where we're still working. You can still call anytime to book your appointment if you're someone who does have significant difficulty leaving the home. But we have an opportunity now to start to transition that program to really address what Dr. already alluded to, which is ensuring that people have a convenient way to be vaccinated. I think our senior vaccination rate is good. We want to see it be better. And so what we're doing is we are actually going to transition Protect Chicago Homebound to Protect Chicago at Home. And what this really means is that we are immediately going to begin offering at-home vaccination. Now, first, we are going to prioritize people that are over the age of 65, so really working to address our seniors. Obviously, still addressing anyone who has significant difficulty leaving the home, but also if you're a person that identifies as someone with a disability, we also encourage you to make the call and request at-home vaccination. Anyone across the city that is over 65, has significant difficulty leaving the home, or is a person that identifies as having a disability is welcome to call the call center, 312-746-4835. to request at-home vaccination. And what's going to happen is they're going to immediately schedule you for an appointment. I want to be honest, that appointment may be 2 or 3 weeks out, but we want to get you scheduled so that you know when you can expect your vaccination. We are offering Johnson & Johnson. Soon we'll also be offering Pfizer through that program as well. But we really want this to be a way that people can conveniently access vaccination, especially if they've potentially in the past been frustrated by how do I find a vaccine or where do I find it. We do hope that moving forward, as we work to address those populations and demand slows there, that we really utilize this as a program to address, especially in our communities where our vaccination rate is low, some of the homes there that we can work to vaccinate as well, because we do know what you heard. We've been to 1,700 plus homes, but we vaccinated over 2,500 people because we rarely just vaccinate a single person when we go out. We're usually getting 1 or 2 people, sometimes even 3 or 4 in a household, and we want to continue that success. So we're really excited. You can call the call center today. We'll be releasing more information about it to start getting scheduled for appointments as soon as next week. And again, if you are a senior or a person that identifies as having a disability, we really strongly encourage you to call and utilize this as a method and get not just yourself, but those that you're living with vaccinated.
Absolutely, great. So just as a clarification then, anybody over 65?
Any Chicago resident may call. And I want to be clear about that because we do utilize our resources in the city. We are grateful that the Chicago Fire Department has taken a leadership role in helping us with this program. And so we do require that it is City of Chicago residents. But no matter where you live in the city of Chicago, you can call and you can get that appointment.
Yeah, and I want to be really clear, this is absolutely free. There is never, ever, ever, ever a charge to the person who is being vaccinated in any setting, and that also applies to at home. There is no requirement for any sort of documentation, paperwork. There is no requirement for insurance. We will not ask for your insurance card or for any government documentation of any kind. So please, if you know anybody over 65, we've been saying this over and over again. It's the one area that Chicago is still not where I want us to be. We are at or above the national average for all of our other metrics around vaccination. We are significantly above really the other large cities in most of the metrics. But when we look at people over 65 plus, we're still behind. Only 69% of our Chicago residents over 65 have gotten that first dose. That's not so good. The nation overall is over 80%. And this is the group I'm the most worried about, particularly as we're moving toward more reopening. And I hear sometimes, talking to patients or talking to families, people think, I'm not at risk, I'm being very careful, I'm staying home, or, I had COVID in the past, why should I get a vaccine? Or I had a test and it was negative, I'm not worried about it. It does not matter, all of those things, you still should get vaccinated, especially if you're over 65 or if you've got an underlying condition, because unfortunately, you're the most likely to end up in the hospital or even to die from COVID. And so, getting our oldest folks vaccinated is really my very top priority, it really is. So I hope this helps with no more excuses, right? Like anybody over 65, they don't even have to leave. You make an appointment and they will come to your house.
And I think it's a great way too to make it a family affair and address everyone living in the household. Because anyone that lives with someone that's over 65, that's out and about, they also present a little bit of risk. So get yourself vaccinated, get your loved ones vaccinated. We'll come to your home. It's very safe. Everyone that's coming to vaccinate is fully vaccinated, obviously, and they maintain social distance. They wear a mask with the exception of when they put that needle in the arm. So we really encourage everyone to take advantage of the program here.
Yeah, and they come with identification. We've done all of the appropriate screening around folks who are coming, and we set it up at a time that's convenient for you.
Absolutely.
All right, great. So number of questions here. So First, Adrienne Hagel, thank you, on Twitter, says, yesterday I got my 12-year-old and 14-year-old vaccinated at Chicago State. Wanted to compliment CDPH on how well organized it was. Really efficient, everyone was knowledgeable, and really nice, great experience. Thank you. I love it when we occasionally get really nice shout-outs like that. Denise Sims on Facebook is saying, why is CVS and some Walgreens from the Edgewater area only giving out J&J vaccine? I'm frustrated. I can't go to my neighborhood CVS to get vaccinated. You want to comment on that first?
Well, I think let me just start by saying that, and maybe Dr. Arwady can cover this too, J&J is a safe vaccine. It may not be your preferred vaccine, and that's okay, but it is a safe vaccine. A lot of work has been done to ensure that it's safe, and I think it's a great option. And to be honest, we're seeing a lot of people choose to get Johnson & Johnson over Pfizer or Moderna because of the convenience of the one shot. But here's the thing, our pharmacies get their allocation and they determine which stores that vaccine is going to go to. So if they've made that particular choice to only have J&J at a particular store, that's really the decision that they've made, and we can certainly talk to them about that and find out a little bit more why, but we would encourage you to contact and find out where you can go ahead and get a shot of Pfizer if you're interested. I will note you can get an appointment at Wright College to go ahead and get a dose of Pfizer. That's a site that we run. It's not that far from Edgewater. If that's something that you're interested in, you can drive through United Center. There are appointments at Wrigley. And I think most importantly, just go to ZocDoc.com. There is a full list, not just of our sites, but of many providers, especially those on the north side, that are actually offering appointments. You could get one today. And in ZocDoc, if you actually look, it identifies the type of vaccine that they're offering there.
Yeah, and I'll just add on to that, we've done a lot of work with our vaccine finder here, and at the federal level, they've been working to pull all of the vaccine finders together. So if you don't mind pulling the computer back up here, so I can show folks. If you just look for COVID vaccine finder, you go to vaccines.gov. So this is for the whole country, but I put in, I'm pretty sure Edgewater is 60660, and I said search radius. I'm going to be really, we're lucky here in Chicago. I'm going to say your search radius is 1 mile, and you see how you can check. You can say I want Moderna, Pfizer, or J&J. So you say I really don't want a J&J. I just want to see who has Moderna or Pfizer. You say search for vaccines, and it will search, and for 1 mile here, look at this, you got 12 places, and everybody, 3 of them right now say they're out of stock with Moderna and Pfizer. It looks like one of the Howard Browns and 2 of the Jewel Oscos are out right now, but here's a number of Walgreens, CVS's, Health Mart Pharmacy, a Mariano's, a Howard Brown, that are showing right now that they have those vaccines available. And then the nice thing is you can click on any of these and it will show you, like you said, you're interested in CVS, you click on it and it'll bring you right there, you can click and see what's the appointment availability. It'll bring you to the website. It's got the phone number. And like, for example, this one is saying they've got Moderna out of stock, but they're saying they have Pfizer and J&J in stock right now. Last updated 6 hours ago. Okay, so there's been a lot of work to make that kind of question easier to answer, and I encourage you to use either the online or always you can call our number, 312-746-4835. We'll help you find a vaccine. I agree the J&J vaccine is a really good vaccine, but you want a different one? We'll help you find a different one, no problem.
Absolutely.
All right, thank you for pulling that up. Faye State on Facebook is wondering, are there any places that give vaccines outdoors? And I think this is perhaps related to, we sometimes hear concerns from people who've been really cautious about, wanting to be as careful as they can with their COVID risk.
I think it's a good question. I'll just start by saying the vast majority of locations that are offering vaccine are currently indoors. And really, most of that has to do with the fact these operations were set up in the winter time and we're continuing to evolve. But there are still places that you can find outdoors. So the first thing I'd say too, if you have a car, feel free to drive through United Center and you can get a vaccine right there. It's a very limited interaction in terms of them actually addressing that. And Chicago State also has a drive-through that you're able to go through. A lot of our mobile operations are now outside, either because we're setting up pop-up tents to do vaccination, or because, as you've probably seen, we're pulling up our vaccination station, our CTA converted buses, to be able to offer that option outdoors. But you will still find that a majority of places are conducting vaccination indoors. That being said, I can tell you the city, we are looking to go to festivals, parks, beaches, so on and so forth, to really get people where they're at. All of these will be outdoor operations, just trying to get to folks really where they're living, working, playing in order to be able to address that. And I think many of our partners are also going to be moving a lot more operations outdoors now that the weather has improved here in Chicago. We know we're not at summer until about July in Chicago.
Yeah, we like outdoors because it also increases visibility, right?
Sure.
We hear a lot of people, they see the vaccination bus at this point. People reach out to me, or, especially when we're talking, throughout this summer as we're starting to really bring back, some of the festivals and some of the parties, black parties, all of this. Opportunities to have vaccination, opportunities there is something we'll certainly be working on as well. Richard Benson from Facebook. If you get vaccinated outside of Chicago, will the data automatically get updated, or do we need to tell CDPH about it in order to count for the percentages? You want to start with that, or you want me to take it?
Well, I'd say we just say if you get vaccinated in the state of Illinois and you're a Chicago resident, it is based on your address, which is why it's important to put your home address down so that we can count towards the percentages. I'll let you talk a little bit about out-of-state vaccination.
Yeah, so right, in-state, it's all set up, no problem. Out-of-state, no worries. You are recorded appropriately, and you still have your home address. There's been a lot of work really at the national level to better link immunization registries. We're very careful with people's private data there, right? And so we don't share out, there's not a national registry that keeps track with people's names or anything. It's really kept at the state level. But for example, we've been working with Indiana to make sure that we can appropriately share that information back and forth and make sure that it's all in place. And there's been some work to make sure that privacy is protected, but still that information can get shared. So as long as you've done it appropriately, if it was anywhere in Illinois, you're already counted. And if it was in another state, we've been working on some of that to make sure that your information is in there. But especially if you were further away outside the Midwest, it may not all be in there just yet, but I'm confident in time they're all going to be linked. Good question. Deborah Schechter on Facebook. Are there online consent forms for COVID-19 vaccines that I can bring when I get a vaccine so I don't have to read and sign when I am there?
Okay, that's a good question. And I will say this is very dependent on who you're going to get your vaccine from. Every provider has a different setup, a lot based on their sophistication of their technology. But I will say for the city of Chicago, actually, when you go to book your appointment, if you're doing it online and you complete your registration online, the consent forms are actually folded into the online process. However, sometimes we do outdoor operations and we use paper forms because, quite frankly, it's just more efficient. And we would ask that you sign your consent right there. So I think, unfortunately, it is pretty provider dependent. And depending on where you go, you're welcome to give them a call and ask that question.
Absolutely. Okay, lots of different things here. I'm going to take, this is actually a question we haven't gotten before, and I'm going to take it. So Veronica Lopez is wondering, my mother is an 83-year-old Hispanic woman who received her second dose of Pfizer on Saturday, April 10, 2021. When taking her to a routine doctor's appointment on Thursday, April 22, 2021, she was given an antibodies test. Through this test, it was found out she didn't develop antibodies for the coronavirus. Why wouldn't she develop antibodies? What can we do in order for her to get antibodies? Should she get the vaccine again? We've been hesitant to take her out, and we continue to do so as we are afraid of contracting the virus. Really, really good question, Veronica, and thank you for writing in. So, we haven't actually gotten this question before, and I think it's an important one. So, okay, first of all, the CDC and CDPH do not recommend getting an antibody test to try to see if you are, quote, immune from COVID after a vaccine. And in fact, CDC doesn't, it's not that they just don't recommend it, they actually recommend against it. And let's talk about why. So, the antibody tests that have been developed, and it really has been a science that has been progressing. Those of you who've been following along for a year know that a lot of the early tests didn't work particularly well, and they've gotten better. But there is not just one kind of antibody that develops when someone either is infected with COVID or is vaccinated against COVID. And one of the issues here is that the most common antibody that gets tested for if you're looking to see if someone was infected previously with COVID is what's called the N antibody. It's against the nucleocapsid, which is just looking for a particular part of the virus, and you look to see, did your body sort of learn how to fight off that virus? That's what an antibody is. It learns to recognize it and be able to fight it off in the future. The problem is the antibody that the vaccine creates is more against, remember, the spike of the protein. And so coronavirus has all these little spikes, and the way the vaccines have been developed is they teach your body to recognize and fight off anything that comes along with those coronavirus spikes. And so the problem is if you've developed an antibody test that's looking for the nucleocapsid, it would be negative unless it's designed to actually look for the spike protein. And so there are antibody tests that look for the spike protein, but even those, we don't yet know the level that you would need to be considered to have protection. There is a lot of research and work going on around this, and if you look at like measles, for example, you can go and get a blood test, and we know if your blood, it's called a titer, is at a certain level of protection, we know you were vaccinated in the past against measles and that you are protected and we don't need to do anything. But we are not there yet in terms of tests for antibodies against COVID. And Israel, interestingly, is the most vaccinated country in the world at this point. And they have actually started to do a little bit with requiring travelers to get an antibody test specifically for the spike protein, because that lets them know that they were actually vaccinated. It's a way to sort of make sure people are not falsifying vaccine information. But the other thing is there is immunity that comes besides antibodies. So antibodies come from B cells. We also have T cells. There's a number of ways in which the vaccine protects you against COVID, and we just don't have a test at this point that measures. And even if we knew that you had a spike antibody, we don't yet know what level you need. So the bottom line is that you should not be concerned that your test was negative after getting vaccinated. We would actually expect most people to have a negative test. The other thing is you actually got it 12 days later. We always wait at least 2 weeks after full vaccination, even before we would consider looking for immunity. So my expectation is in 6 months or a year, we may actually have a test that can help work that out. But except for a few people who have serious sort of immunodeficiencies, immune problems, who are working with specialists, who are doing some specialized testing, for the general population, for your 83-year-old mom who got her 2 doses of Pfizer vaccine, her protection is very, very, very good. And I would feel very comfortable with you letting her go back to her life, as I recommend for everybody who's fully vaccinated. So really, really good question. And thanks for bringing that up. Okay, at VaxPMO on Twitter is actually, looks like this might have been from before, but is commenting about the vax stops. Like I think maybe the same person had asked how many do we do? And we had said we might do 50, for example, in a 2-hour stop. And he's saying that's a great yield. We should scale it up. Is there any reason we can't get more buses and really go block to block through the least vaxxed neighborhoods? We have billions in federal aid for this. We actually don't have billions of federal aid here, but we do have a lot. So to the original question, yeah.
Well, what a great idea. We're doing that, actually. I think that's a great point. So I'll tell you from an operational standpoint, the vaccination station, our bus, is what we call an operational asset. We have a lot of different ways that we can bring vaccine. We can put up pop-up tents. We have partners that also have mobile units that we can use. But we do, and we're grateful to the generosity and the partnership with CTA that they have actually converted 5 of those buses. We're actually also working to get some Sprinter vans out that will be very cool and wrapped and utilized for mobile operations. But we are doing block by block. That's actually the program that we're calling it. We've been piloting it in Austin. Very grateful to the 15th District and the faith leadership out there that have been working with us. And what we do is we actually take a bus and we park it in the middle of a neighborhood, and then we work with our community-based organizations, churches, in the case of Austin, the Chicago Police Department, and they go door to door and they tell people that the bus is out and do you want to come out? And actually we're seeing fantastic yields from that. So we are going to be doing that in all of our lowest vaccinated communities. You're going to see that more and more. But what we also know too is that you got to get to where people are. So you're going to see us at food pantries and distributions. You're going to see us at popular beaches like Montrose Beach on Rainbow Beach on Memorial Day. You're going to see us out potentially, and we're hoping to actually get to some places where you see long lines for things like city services. And then we're also going to schools. I mean, we're at 5 locations for CPS every weekend right now. And we're going to be going to partner with some of our charter schools to actually show up in the afternoons too. So actually, we're going to get to the point where the city and our partners are doing almost over 100 events per week just in mobile operations, just to get to the 50 or so people that we get every time that we go out. And the reason for that is because those 50 people are people that may not have been vaccinated otherwise. They're people we're talking to about vaccine, and they're coming out to be vaccinated. And oftentimes they do live in our communities that have been disproportionately impacted by COVID and actually experience some of the worst outcomes. So we're going to actually start pretty soon putting up a weekly schedule of all our mobile activities. So if you want to come and check it out, please do. We try to pair them with music and food so that it's a little bit fun, because vaccine is hopeful, and we want to make sure that we convey that.
It is, thanks. So I've been trying to choose a lot of the operations questions to make sure Tamara can answer them while she's here. I see a lot of you are putting in various questions sort of related to masks. Again, we're talking about most of this really at 1 o'clock, but let me hit a couple of these things just really quickly. So at Nurse3Old on Twitter, when will there be a vaccine approved by the FDA that is not made from aborted fetal cells? Right now. Pfizer, Moderna, no aborted fetal cells. That's one myth that is circulating. Again, encourage you to get vaccine. At GG45781 from Twitter, please talk about the irregular periods females are getting. So no sign, 0 signs in a lot of studies that this vaccine is in any way linked to problems with fertility, to problems with people being sterile, men, women, etc. There was a lot of attention. There was actually a local study here that was looking at perhaps right after someone has gotten vaccinated, they were pointing out that they had not asked about changes in menstruation. And there's a study that's looking at, in the same way that in the few days right after someone gets vaccinated, do they get a heavier period? Do they have a lighter period? Do they have a change in their period? But I want to emphasize that, first of all, this was not linked to anything that was long-term, not ongoing irregular periods, not linked in any way to anything that was dangerous related to anybody being infertile or there being any sort of long-range risk. And in fact, I thought it was an interesting study because it's meant they've been looking some more at hormonal levels, et cetera, related to this. But I really want to reassure you, and thanks for the question, that we have not seen any sign of ongoing irregular periods or anything that would disrupt fertility for women or for men related to any of these 3 vaccines. Also, just quickly here, I'm Your Huckleberry on Twitter says, can we talk about how nursing homes have the highest NPI? NPI means non-pharmaceutical intervention, for those who don't know, but the virus spreads rapidly there, almost like masks don't work. Okay, so let's talk really quickly about nursing homes. Nursing homes have been the most dangerous place that you could be for COVID throughout this entire outbreak. And we've got 78 skilled nursing facilities here in Chicago. And those are, when I say skilled nursing facilities, I mean places where people are needing hands-on care, for their work. They need help for their activities of daily living and really have a lot of underlying conditions, tend to be older, and then staff are needing to really, they can't keep their distance. There has to be a lot of this. There's been very strict masking, distancing. We had limited family visiting for so long. CDPH has been, on site at these spaces, really helping when there's been outbreaks. It was really when vaccinations came in that we were able to see a huge decline in terms of cases. I can't tell you how relieved we have been to see those numbers fall off. And I've showed that before on Facebook. We could bring it up again, but it's just this visual image for me of how important vaccine is. So masks help in that setting, to be sure. And we saw people, they've had very careful masking protocols. But when you can't mask, when people are so vulnerable, it's part of why vaccine is the most important thing you can do to really protect yourself. So masks have helped, no doubt, and thank you to everybody who has worn masks and done distancing. But I want to, getting that vaccine is by far the most important long-term thing. And we're so lucky. That's the thing. We're so lucky to have a vaccine at this point that's safe and effective, widely available, free. Because when a whole nursing home, for example, is fully vaccinated, we basically don't see COVID be a problem anymore, right? It went from the most dangerous place to a place where there's almost no concern. And that really is the context in which the CDC did make that change. And I am just going to take a couple because I can see there's a lot of people who are on here sort of worked up about this. So like @FreeBarely on Twitter says, do vaccines work? If they do not work, why are you asking people to get them? If they do work, why do we have to wear a mask? I'm asking for science-based answers, not policy ones. K, thanks, bye. So, you know, @FreeBarely and others who are really writing these things. Vaccines very clearly work. We are so, I can't tell you how pleased I was to see initially the trials, but then for these to perform in the real world. You know, 95% protection is about as good as a vaccine gets, and almost full protection against the severe outcomes like hospitalization and death is about as good as a vaccine works. And it is because, you know, I don't know if you were maybe thinking, I'm not going to get a vaccine because I still have to wear a mask, and what's the story here? And it's probably people like you that CDC said, you know what, we're going to really double down and put our faith in these vaccines. We know they work well. We know where everybody is vaccinated, it's not necessary for us to continue doing these other things. And so when you are in a setting where everybody is vaccinated, fully vaccinated, 2 weeks post their second dose, you don't need to wear a mask because that vaccine will protect you better than the mask will, better than the distancing will, better than the hand washing will. And we have increasing science that it's not only protecting you, but it's also protecting those around you. And so it was really as that, you know, we've gotten more and more evidence that the vaccines work in the real world and that they remain protective against all known variants of concern. Can't say that strongly enough. You know, getting vaccinated now is why. And so it's not that vaccines work and masks don't, or masks work and vaccines don't. They both work, they both help, but the vaccine, if you're going to choose one, is the one you're going to choose. And that's why I think CDC really doubled down on that, so that if you've been holding off saying, I don't want to get a vaccine because I'll still have to wear a mask, we're saying to you, get fully vaccinated, and that, you know, that requirement for masks isn't going to be there anymore. Okay, let's see. We're just about at time, actually. So just very quickly, Tom Sivak on Facebook says, we're excited children are starting to be vaccinated. Any idea when the age range will be lower than the age of 12? I don't know for sure. The studies are still ongoing and they're testing doses. Pfizer has estimated perhaps by September they may be able to submit data to the FDA about children under the age of 12. So we're looking at the fall, I think, but you can't rush this. You got to get the studies done. We obviously want to make sure the vaccines are safe and effective for children. And we don't skip any steps. At no point have we skipped any steps here. All right, so we are out of time today. I encourage you to tune back in at 1 if you want to hear some more details about how in Chicago we're going to be addressing this CDC mask guidance and really what it means. But the bottom line is, you know, get yourself vaccinated. It's going to make your life easier in a lot of ways, and it's going to protect you, your family. I've got no goal other than getting Chicago past COVID. Again, thank you, Tamara Mahal, who has been just instrumental in terms of keeping all of the trains running on the same track for what has been an enormous operation in terms of getting Chicago vaccinated. Any good news or last words you want to share?
You know, I'm excited because actually yesterday we passed a big milestone, and as of yesterday, 1 million Chicago residents have been fully vaccinated with the complete series of vaccines. So we were really excited when we hit 1 million Chicago residents with their first dose. We're just even more excited to see that number go to complete series. Every time we hit one of these milestones, especially as people that have been here since dose 1, it is such a huge achievement. We just want to thank everyone for going out and getting your vaccine to keep us and our families and our community safe. And if you haven't had the opportunity, please, there's more than enough vaccine to go around, and hopefully we'll see you out in your neighborhoods.
Absolutely. I don't have any good news to add that's better than that. So thank you so much for joining. Thanks for your questions. Again, at 1, we'll hit more of this mask. I'll be back with Sybil Madison on Thursday, and we'll take some more of your questions if you've still got questions after that. But just get vaccinated. Talk to everybody you know. And with our new at-home initiative, I hope, especially for folks over 65 or those with disabilities, really no excuses. Let's get everybody vaccinated and make this, you know, something that we're thinking about in retrospect.
Absolutely.
Thanks so much for joining. We'll see you Thursday.